Thank you for taking the time to review this information on how to become a more effective preceptor. I hope you find this information valuable as a clinician and teacher. I want your experience as a clinical instructor to be enriching, straightforward, and organized. This short presentation should help guide you to be a successful clinical instructor. The course outline is simple. The topics I'll be covering are being a better communicator, doing a careful analysis of the learner, having skill and practice in teaching, how to motivate the learner, and using the 1-minute preceptor and 5-step method to teach clinical skills. Communication is key. As a clinical instructor, we possess and demonstrate a broad depth of knowledge in the field of physical therapy. Students potentially will be asking questions on nearly anything related to physical therapy. It is okay to not know everything when they ask a question. It is also okay to point them in the direction of the appropriate textbook if you do not know the answer. We make decisions for patient care based upon what we see throughout the day and our prior clinical knowledge. Explaining to our students the reasons for our actions is important so they can also fill their pool of knowledge and decision making. That will help improve their problem-solving skills. It's always beneficial if you can ask the student the why. Why did you think I chose that intervention? Ask the student what might be an intervention that you could use that would get a similar response. When they select specific interventions, ask them to justify their choice. And when answering their questions, be clear and concise. Students and clinical instructors alike should be open to conflicting ideas and opinions. You can put a physical therapy case in front of 10 different clinicians, and all 10 therapists may have a different approach. Each therapist has their own unique clinical and life experiences, and those experiences need to be respected. The students have learned a wealth of didactic information, but now they're being asked to apply it in a real-world sense. Helping them bridge that gap to connect a comorbidity to what you can expect a patient will look like is important. Day one of that rotation, clear communication must happen between both you and the student. It would be beneficial to discuss what goals the student has for themselves and what goals you have for the student. Define the expectations you have for the student. For example, give them clear information on your documentation system and how your facility documents. Make sure they know their grading expectations for this rotation. They also need structure, your guidance, and your assurance to build confidence. It's best practice to provide them feedback on how they are doing so they can adjust accordingly. That feedback can be given in the moment, but be careful to not negatively criticize the student in front of the patient, as it can be damaging to the student's confidence, and limit their abilities working with patients in the future. Bring the student aside to discuss negative feedback. Capturing the student's attention shouldn't be difficult. Just being in the moment and being their coach should get them engaged. Finally, make learning fun. This is an exciting time for both of you. Simply being positive, professional, open to their ideas, and using the moments you have will make their experience stimulating and fun. We need to analyze our students' knowledge. Simply talking to your student can help you understand what they know and what they don't know. Ask them questions on muscles, nerves, diagnoses, or what experiences they have with specific conditions. You can ask them how to do an ultrasound, how to set up a specific modality in that setting, a patient's response to exercise, or something specific to your facility. Communicate with your student by asking them, what areas do you feel weak in? Those weaknesses can be focused on for part of the rotation. Watch the student perform soft skills with other people in the facility. When actually working with patients, ask them their rationale for their choices. Feedback is crucial. As I mentioned before, it is essential to limit negative feedback in front of patients. Generally speaking, patients and people perform better with positive feedback. So, even if the student is doing something right, it is good to reinforce that. Finally, make sure you are cognizant of the grading requirement for the CPI web for the PTA. The APTA Learning Center training is an excellent method to know how to evaluate the student. The students will take everything to heart, so be clear and specific on things they are doing well or need to work on. Communicate these things with them so they aren't in the dark. For skill in practice and teaching, we must be acting as a positive role model for the profession. It demonstrates best practice and excellence in professional behaviors. Having the attitude of, I get to go to work today rather than I have to go to work today can make a huge impact for you and the student. We educate our patients on why we are providing these skilled services, and teaching the student is no different. You can always ask the student, why is this intervention a good choice? Have the student read the chart, eval, or previous day's note, and then provide any additional information that is concise and to the point. Try to stay away from obscure details that take away from the meat and bones of that case. And when teaching about the case, you can generate interest in the subject matter by providing any additional information that you deem pertinent. To help organize and control the learning experience, you can always have the student read the eval, then follow along with you during the first treatment session. Then the next time they can try treating it with your guidance. And then to summarize, they read it, see it, then be it. Being in the field of physical therapy, we are constantly balancing our administrative and clinical duties. Truly, we are experts at multitasking and adding teaching to the responsibilities. Must be balanced to help you be successful. You don't want to give too little responsibility to the student so they don't benefit, while at the same time so much responsibility that the student becomes overwhelmed. Start slow and add to their responsibilities based on how they are performing. It's good to communicate with them to understand how they are feeling with the workload. Helping them become autonomous is a good goal to have. To motivate the learner, we must emphasize problem solving. They have a wealth of knowledge from a didactic sense, but they do not have the years of experience to draw from to make specific clinical decisions. For example, you could present them a case and they should be able to draw conclusions based upon the data. After drawing conclusions based on the data, they should be able to create specific interventions based upon what they see. You can provide specific case examples to them so they can generalize your examples and apply it to a current case. Having them read the evaluation or the prior day note will promote active involvement of the student. You can ask them follow-up questions to help increase their involvement. All the while, you can demonstrate enjoyment and enthusiasm for the patient care and teaching, because physical therapy is a wonderful profession. Again, just being positive and supportive can go a long way for your experience and the student's experience. Ask them how you can support them further. So let's take a look at this 1-minute preceptor. First, get a commitment from the student by asking them, what do you think is going on based upon what the patient has told you? At this point, whatever information they tell you will give you a good insight of their knowledge, skill level, and how they think. Help them understand what the data means if they don't know. Try stimulating their thought process skills by asking them, what does the data mean? For example, if a patient has a 45-second timed up and go, ask the student, what would you expect to see for their locomotor skills or fall risk? Number 2, probe for supporting evidence. Ask them the why. What led them to come to the conclusion that they made based upon what they saw? Understanding their thought process will help identify any knowledge gaps they may have. The sooner you can understand knowledge gaps, you can provide better guidance to help them learn the material. Third, teach general rules. For example, when you see a patient grimacing during an activity, always consider, what's causing them to grimace? Is it pain related? Is the intervention challenging? Offer them precious information that they can easily remember when treating common cases. The fourth item is to reinforce what was done well. It is always better to offer positive reinforcement so the student knows what they are doing is correct and acceptable. For example, you can let them know they did a nice job with cueing of a patient on a specific task. The fifth part of the 1-minute preceptor is correcting the errors. Again, it's important to wait until the patient is away to provide error correction. If the intervention is potentially dangerous for the patient, just simply ask the student to stop and ask them to speak privately really quick before continuing. It would be a good time to understand their thought process on selecting a specific intervention that might be harmful for the patient. It's always good to find a time to debrief after each patient or when it is convenient for the two of you. And finally, the 5-step method for teaching clinical skills starts with providing an overview on how to treat patients using skilled interventions. While working with a patient for the first time with the student, you can start by the phrase, teach it. Teach them through demonstration and verbalize how you use it in patient care. Then demonstrate the skill again without any commentary. Then repeat the procedure while simultaneously describing each step. Have the student then talk through the skill, detailing each step. Then hand the patient over to them so you can observe the skill and provide feedback to the student. An easy example is to provide an overview of a rotator cuff tear and the need to increase range of motion after the surgery. Show the student how to complete the passive range of motion without telling them what you're doing. Simply ask them to observe everything that you're doing and be prepared to replicate it. Repeat the procedure, then describing each step that you would take to perform the skill. Then have the student talk through the skill by detailing each step. Finally, hand the patient over to the student and observe them completing the range of motion activity and provide feedback on where you see fit. The feedback could be anything from hand placement, patient comfort, or body mechanics. I am here to support you any way I can. Thank you for taking the time to review this information on how to become a more effective preceptor. I hope you find this information valuable as a clinician and teacher. Please reach out to me if there's anything you need.